Initiative for Health Accountability and Transparency, welcome you to Continue Professional Development course on Primary Healthcare Renewal for Optimal Performance. This is Module 1 and it is on understanding the core values and primary healthcare development framework. The contents of this module include the learning objectives, introduction, basic concepts and core values, the primary healthcare development framework, and the effect of the framework on the shape, direction, and outcomes in the PHC approach. And then we will draw a conclusion. Let us look at the learning objectives. On completion of this module, participants will be able to enrich their understanding of the basic concepts in primary healthcare approach, will also enrich their understanding of the principles and core values of PHC. They will be able to describe the PHC development framework and also describe how the PHC development framework determines the shape and direction of the PHC processes, and also how the PHC development framework determines the outcomes in the PHC approach. Access to primary healthcare is the foundation of good health, and primary healthcare is the major determinant and driver of a nation's health outcome. PHC remains an important force in thinking about healthcare in both developing and developed countries. In many countries, the primary healthcare system is the cornerstone and the hub of the health system. Nigeria is not an exception. PHC is the foundation of the national health system. We have promoted the practice of primary healthcare for over 30 years in Nigeria. Recall that PHC was launched in 1986, and for a significant part of these years, primary healthcare system had remained grossly inefficient and ineffective. What we know about primary healthcare is that there has been systemic weaknesses arising from gaps ranging from infrastructural decay, inadequacy in human resources, essential drugs, and other supplies. As part of Sustainable Development Goals, the global community has adopted universal health coverage as a powerful concept in public health. The existence of a well-functioning health system and the timely access to services is critical for attaining universal health coverage. We also know that there can be no universal health coverage without primary health care, and that attaining universal health coverage is not just an option, but a necessity. What iHeart is doing is that we have created continued professional development courses on primary healthcare renewal for optimal performance as a token contribution towards building necessary understanding of what we can do. Let us look at the background of primary healthcare. Recall the historic International Conference of Primary Healthcare in Alma-Ata. The resolutions agreed at the conference constitute the Primary Healthcare Charter, and the overall outcome is the Primary Healthcare Alma-Ata Declaration. Continuing on the background, primary healthcare was adopted as a philosophy for addressing gross inequity and inequality that existed in health development. It was the first attempt to unify global thinking about health within a single policy framework. Primary care is a model for building health systems that will address inequity and inequality in health outcomes. However, despite the prospect of primary healthcare, many developing countries continue to suffer the greatest burden of diseases. In the like manner, the health systems remain too fragile to cope with the health needs of the majority of the people. Let us look at the continued relevance of primary healthcare and the renewal efforts. Though persistent challenges remain in PHC development, the global community still believes that primary healthcare approach is more relevant today than ever. There is a global momentum towards renewal of primary healthcare, with calls echoing at international, regional, and national conferences. At the global stage, the WHO launched the World Health Report in 2008. It was christened PHC now more than ever before. In Africa in 2008, there was the Ouagadougou Declaration on Primary Healthcare and Health Systems in Africa, achieving better health in Africa in the new millennium. The 62nd World Health Assembly in 2009 passed a resolution on primary healthcare, including health system strengthening. Many other international conferences have been convened to further put PHC on the global agenda, including the recent one that took place in Alma-Ata. Let us do a brainstorming exercise. Is primary healthcare a system of health care? Primary healthcare is not a system of healthcare. It is a part or a level of the health system, but embraces overall socio-economic development of the community. It is an approach or a strategy or a philosophy. It is an idea of the way of dealing with the situation or problem of inequity and inequality in health development, including service delivery and health outcomes. The definition of primary healthcare is very all-encompassing and clear about what it is all about. Note down the key phrases in the definition of primary healthcare. Let us look at the principles and the core values of primary healthcare. And take a small brainstorming exercise. Is there any difference between the PHC principles and the core values? You've just taken down and noted key phrases in the definition of primary healthcare. Let us look at some of these. The first you would have noticed in that definition is essential healthcare. It means primary healthcare is vital and indispensable to addressing common causes of morbidity and mortality. It is based on practical, scientifically sound, and socially acceptable methods and technologies, meaning it is based on rational and logical techniques and procedures, and not based on voodoo, witchcraft, or ministries. PHC is made universally accessible to individuals and families in the community, means it brings healthcare as close as possible to where people live and work. And this way it addresses issues of universal access and equity. It is also based on community involvement and participation. In primary healthcare, the people are the central focus and are actively involved in the planning, implementation, and management, including monitoring and the evaluation of health services. The people should own and drive primary healthcare. Looking at the spirit of self-reliance and self-determination, primary healthcare is based on the costs that the community and the country can afford to maintain at every stage of their development. This element is the key to sustainability of primary healthcare. And on primary healthcare as an entry point into the health system, it is the first level of contact of individuals, the family, and the community with the national health system. Looking at the issue of continuing healthcare process, primary healthcare constitutes the first element of a continuing healthcare process that starts from an individual, a family, community, the PHC facilities, the general hospitals, to specialist hospitals. The PHC approach is a means of achieving health for all. The approach, which presupposes the full participation of communities and ensures that essential healthcare is accessible to all individuals and families at an affordable cost. It is based on the principle of self-reliance and self-determination and is most efficiently implemented. Let us come to the fundamental issues in PHC approach. There are underpinning core issues that are central to primary healthcare. The issues have become widely shared social expectations for healthcare development in general. The issues have been clearly articulated in Alma Ata Declaration and several publications. The first issue is primary healthcare as a national policy trust. Each nation is required to make a strong and continued commitment to primary healthcare at all levels. This is in the spirit of social equity. In the case of Nigeria, there are commitments at all levels, but the issue is whether these commitments are adequate and sufficient. It is recommended that primary healthcare be adopted as the foundation of national health systems, and health systems be organized to support primary healthcare and make it effective. While we all know that primary healthcare is the foundation of the national health system in Nigeria, the level of support to primary healthcare to make it effective by other levels of healthcare is debatable. Countries are encouraged to establish national strategies for primary healthcare to translate policies for primary healthcare into action. Nigeria has established the National Primary Healthcare Development Agency that has developed the national strategies for primary healthcare to translate policies into action. Looking more at the issue of national policy, it was recommended that governments articulate national strategies with well-defined goals and develop and implement plans of action to ensure that primary healthcare be made accessible to the entire population, particularly the underserved areas where the vulnerable people the poor, and those in the rural area live. In Nigeria, some action is taking place in this respect with the development of National Health Strategic Plan, which was just recently revised. It was also recommended that governments reassesses these policies and strategies and plans for primary healthcare in order to ensure the adaptation to evolving stages of development. It also necessitates reorientating the existing system to ensure that all levels of the health system support primary health care by facilitating referral of patients and consultation on health problems. There is much to be achieved in this respect in Nigeria. Also, by providing supportive supervision and guidance, logistics support and supplies, and through improved use of referral hospitals. Referral system is not known to be working very well in Nigeria, and there is need to see how this can be strengthened. Primary healthcare is a comprehensive approach. The PHC elements addresses the main health problems in the community, providing promotive, preventive, curative, and rehabilitative services, and also emergency care appropriate to meet the main health problems in the community. It is an integral part of a comprehensive national health system, encouraging the full participation of the population in all health-related activities, and includes all activities that contribute to health at the interface between the community and the health system. In order for primary healthcare to be comprehensive, all development-oriented activities should be interrelated and balanced so as to focus on problems of the highest priority as mutually perceived by the community and the health system. That culturally acceptable, technologically appropriate, manageable, and appropriately selected interventions should be implemented in combinations that meet local needs. Comprehensiveness implies that single-purpose or vertical or selective programs should be integrated into primary healthcare activities, meaning that there should be no room for vertical or selective programs in primary healthcare. Functional linkage should be sustained by integrated, functional, and mutually supportive referral systems. So the need to make referral system work is very, very fundamental to effective PHC service delivery. Comprehensiveness will lead to the progressive improvement of comprehensive health care for all and giving priority to those most in need. Now let us look at the second issue of universality and equity. Universal access and equity is at the center of primary healthcare approach. PHC approach reduces the gap between the haves and the have-nots in relation to access to healthcare and result in equity. The ability to obtain healthcare is often determined to a large extent by resource allocation and individuals' purchasing power. Through policies aimed deliberately at allocating greater resources to the underserved and vulnerable group, innovating financing mechanisms and exemptions. All these will help to ensure universality and equity in service delivery. On community participation, primary healthcare is predicated on full and organized community participation and ultimate self-reliance, with individuals, families, and communities assuming more responsibility for their own health. Community participation in the recognition and finding solution of their health problems, and this can be facilitated by support from groups such as the local governments, local leaders, voluntary groups, youth and women leaders, consumer groups, the NGOs, as well as by accountability to the citizens. Community participation can be encouraged through the effective propagation of relevant information, increased literacy, what we call functional literacy, and the development of the necessary institutional arrangements such as the committee system of health development committees, through which individuals, families, and communities can be mobilized to assume responsibility for their health and well-being. It is recognized that community self-reliance and social awareness are among the key factors in human development, and that people have the right and duty to participate in the process for the improvement and maintenance of their health. Another key issue is the multi-sectorial collaboration. Primary healthcare is an integral part of socio-economic development process and consider the close interrelationship and interdependence of health and socio-economic development. Hence, activities of the health sector must be coordinated at national, state, local, and community levels with those of other socio-economic sectors. And this includes education, agriculture, animal husbandry, household water, housing, public works, communications, and industry. Health activities should be undertaken concurrently with measures such as those for the improvement of nutrition, particularly of children and mothers, increase in production and employment, and a more equitable distribution of personal income, anti-poverty measures, protection and improvement of the environment. Looking at the issue of appropriate technology, primary healthcare requires the identification and use of technologies and methods that contribute to health, that are scientifically sound and adapted to local needs and acceptable to the community, and are maintained by the people themselves. And this is in keeping with the principle of self-reliance with resources the community and country can afford. Appropriate health technology that people can use and afford include adequate supply of low cost and good quality essential drugs, vaccines, biologicals, and other supplies and equipments, as well as functionally efficient supportive healthcare facilities such as health centers and hospitals. All these comes under appropriate technology, and they are key to effective primary healthcare service delivery. Let us look at the issue of international partnership. Primary healthcare recognizes the role of partnership with international organizations, multilateral and bilateral agencies, NGOs, and other key partners in health development. It could recommend that partners give technical and financial support with full respect for the principles of national self-reliance and self-determination, and maximum utilization of locally available resources. Partners should encourage and support national strategies and plans for primary healthcare as an essential part of overall development. They should also play a key role in the formulation of plans of action at the regional and global levels to facilitate the mutual support of countries and mobilize other international resources for accelerated development and sustenance of primary healthcare. Let's do a brainstorming exercise. And this time we're going to look at PHC development framework. What does PHC development framework mean to you? PHC development framework is the structure that facilitates the implementation of primary healthcare based on principles and rules that holds together the whole idea of primary healthcare approach. All countries have political administrative structures consisting of three hierarchical levels: the national, the state, and local. A PHC development framework fits well into this hierarchical arrangement. The configuration facilitates linkage between primary healthcare and socio-economic development. The development framework is made up of 4 layers. Let us look at the primary healthcare development framework. It is made up of the color-coded levels, starting from the community level, where individuals, families, and communities access health services. And the second layer is the LGA level, which provide operational support activities to service delivery both in the community and at the facility level. And you also have the state level, which is basically made of state PHC development agency and state Ministry of Health. And this level provides technical support activities. And on top of it all, you have the national level, comprising of the National Primary Healthcare Development Agency and the Federal Ministry of Health. And this basically provide strategic support activities. And on the outer side, right and left, you see some other partners that relate with each of these levels. You have the health-related programs of other government sectors. We mentioned before there is intersectorial approach and agencies, and on the left side you have health-related programs of NGOs, CSOs, CBOs, and also the training institutions, including the universities. Let us look at these levels one by one. The first, like we mentioned, is the community-based level. Implementation and execution of PHC activities take place at this level. The community level collaborates with government and other stakeholders to identify needs, develop health plans and health activities, and oversee the use of health resources, and focuses on services for individuals, for families and households, and also the communities. And services at this level are managed within the wards and the LGA level. The next level is the operational level. It is the LGA level and has responsibility to operationalize and implement programs. The structures and the institutions at this level provide overlapping operational support. It is at this level that all resources are pooled for implementation of primary healthcare. The technical level is the state, and it provides oversight for policy implementation. The structures and institutions at the state level provide overlapping technical support to PHC operations. The focus basically is support to the local government health authorities. It is at this level that technical options are selected or adapted and applied to primary healthcare. This level is not an implementation level. There is the strategic level support, and this is happening at the national level, and it has mandate to formulate policies and provide strategic oversight. The structures and institutions at the national level provide overlapping strategic support for primary healthcare operations. In Nigeria, the structures include the ministry, departments, and agencies in the health sector at the national level. That is the Federal Ministry of Health and the National Primary Healthcare Development Agencies and other related departments and agencies. We have looked at the various strata or levels of the framework. What is the need for the framework? The framework is designed to help ensure that at all levels, other health-related sectors, private sector, development partners, and academia will assist in strengthening health services. The framework also helps in resolving basic issues of reviewing health policies and restructuring services with a view to making them people-centered. It also ensures adoption of uniform and appropriate operational units and organizing appropriate support for them at higher levels. The framework also ensures adoption of appropriate organizational structure for health and socioeconomic interventions. It helps people, government and partners share responsibility for achieving health for everybody. It helps in overall improvement in health and socioeconomic development. The framework further provide appropriate organizational structure for health and socio-economic interventions with the support of external technical cooperation and through people-to-people cooperation. It helps people, government and partners share responsibility for achieving health for everybody and result in overall improvement in health and socio-economic development. Let us look at the impact and the effect of the development framework on the shape, direction, and outcomes of primary healthcare approach. Fitting the PHC development framework into the political administrative structures allows for sharing of responsibility for achieving health for all. However, this is seen to be an obstacle to development of integrated health system and ineffective collaboration between the levels of healthcare. The other effect is the pooling of sufficient resources, human and material, from the strategic and technical levels to the operational level for implementation of primary healthcare has constituted a major challenge that has continued to undermine the performance of primary healthcare. The PHC level ought to have more than sufficient human and material resources. However, this is not often the case. One of the impacts or the effect is that the framework does not clearly spell out necessary parameters and conditions for seamless integration into functional and mutually supportive referral system. As we see later in the course of this course, there is dichotomy between the primary healthcare, secondary and tertiary care, to the extent that some people see primary healthcare as a parallel program and as a silo. Looking at the impact further, the PHC development framework is the driver and determinant of the shape and direction of PHC processes and the poor health outcomes in Nigeria. Primary healthcare in Nigeria can best be described as a silos or parallel program within the health system. Furthermore, directly or indirectly, the framework is responsible for lack of functional integration between the levels of healthcare and is also responsible for continuing challenges of insufficient human and material resources at the operational level. And lastly, lack of clearly spelled out parameters and conditions for seamless integration into functional and mutually supportive referral systems. All these are responsible for the weakness in the PHC system and the resultant poor health outcomes. Scoping the future of primary health care in Nigeria. There is continued decline in PHC know-how at many levels of practice. The future of PHC will require a renewal of commitment and bridging the gap between policy and the current realities. A new future for PHC will be predicated on clear understanding and the implementation of the three frameworks: the PHC development framework, effective service delivery framework, and the primary healthcare competency framework. All these are required to promote efficiency in health service delivery and also quality of care. Let us take an assignment. In what ways does the current situation at the LGA level constitute serious impediment to primary healthcare implementation? This submission should be based on your experience at your various stations or bases. Online submission to be marked CPD PHC assignment of not more than 500 words to be submitted to iheartnigeria@gmail.com. You are requested to reflect on this vision and see to what extent has this vision been accomplished. Taking the conclusion, strong PHC is essential for improving health outcomes and accelerating progress towards universal health coverage. Despite considerable investments in the health sector over the years, availability of functional health facilities still presents significant obstacles. There is stagnation and underperformance in many spheres of primary healthcare development in Nigeria. Primary healthcare is the foundation of the national health system, and Nigerian health system is organized to support primary healthcare. And in the spirit of social equity, Federal Government of Nigeria has continued to demonstrate strong and continuing commitment to primary healthcare at all levels. This is a call to service. Putting PHC back on the national agenda is a task that must be done. Our dream for a strong health system and better health outcomes will remain a dream unless we work for it. To work for it, we need clear understanding and commitments towards primary health care. Strong leadership, effective management, and transparent governance is the key to better health.